Welcome to another episode of Inside Miami Medicine. Today we have the blessed privilege of having with us Dr. Nanette Vega, Assistant Professor of Medical Education and Assistant Dean for Diversity, Inclusion, and Community Engagement. Dr. Vega, welcome.
Pleasure. Thank you for having me.
Absolutely a pleasure to have you here.
Thank you.
Been looking forward to this podcast.
As I have been as well.
So, you've been an integral part of the middle school family since 2010. So tell us a little bit about your story, about your journey, and how you became interested in higher education and what ultimately led you to the middle school of medicine.
Yes, so thank you. So yes, my background is not in higher ed. I have a non-traditional background. I graduated with a degree in sociology and Spanish literature. Mm-hmm. I was a social worker for the state of Massachusetts for 2 years and fell into higher ed. Got my start in admissions at the University of Massachusetts, Dartmouth, and was then recruited by the University of Miami to recruit for them. And so my start was 23 years ago. Hard to believe. Last week I celebrated my 23rd year of service. Wow. To the University of Miami and started in admission.
Wow. So tell me, what challenges did you face as a first-generation college student attending UMass Dartmouth College?
So many challenges, and many first gen still face these challenges because we understand these are all systemic issues, right? It was very difficult navigating the complexities of a higher education, not having anyone at home that I could talk to about school or classes or financial aid and all of those things. I think the biggest challenge was the cost associated to attending the school, although I was on a scholarship. But it was through many mentors along the way that poured into me that really changed the trajectory of my life. And it is by no, chance that I ended up in education.
Sure. So you must have been feeling some element of isolation being the first gen. So how did you overcome those barriers and how did you build a network to help you succeed?
Yes, the network is so important. It was through student organizations. It was through offices like the one we established here at the Miller School of Medicine that I found my way and helped build my cultural capital to navigate college. Sure. And so, again, it was all mentors that poured into me along the way that I still stay connected to and now volunteer with the University of Massachusetts, Dartmouth, and serve on the Alumni Advisory Board and establish a scholarship for students that are just like me or were like me. And I always say once first gen, you're always first gen. First gen bachelor's, first gen master's, first gen doctorate. And so it continues to be a challenge, but I surround myself with people that are like-minded, that will serve as sponsors behind the scenes. And I continue to invest in myself with professional development, which is very important.
Sure. No, it's absolutely wonderful. So as you reflect back, as you look back on your journey, what has the impact of education been in terms of changing your personal life and vis-a-vis your own family, siblings, and so forth? Just tell us a little bit about the importance of education.
I always say we live in the best country in the world. In one generation, I got to change my family story. And although my parents, specifically my mother, did not understand the education system here in the United States, we're from Puerto Rico, she instilled the importance of pursuing education. And it has changed our life tremendously. And now the conversation with cousins and extended family, it's not, are you going to college? It's what college are you going to?
Got it.
And it's been so powerful.
So this has been a game changer.
Completely. Completely.
Good. Now, you also often mention in our conversations the concept of onlyness. You were the only one basically in the room, the only Latina. And so how have you managed to navigate through all of this to reach your position today?
Yes, and I know it's something that you're working hard to change and diversify, staff and faculty here. This idea of, sense of belonging and being able to add value, it really starts with this notion of seeing yourself represented.
Sure.
You can't be what you can't see.
Mm-hmm.
And so for me, it's really been about identifying mentors, not only within the UM community, but, nationally, that can serve as mentors to help me continue to navigate the complexities of a higher education system at the leadership level.
So this concept of onlyness is a motivating factor for you to implement change.
Absolutely, absolutely,
Mm-hmm.
because I am the students that we represent.
Got it.
And nothing brings me more joy than to be a part of a student's, trajectory here at the Miller School of Medicine.
And so, in tying it all in together, how does that influence your perception of diversity and inclusion at the Miller School and its importance in the lives of the other students?
I think we share a similar philosophy. I believe that, for a long time, many institutions just focused on who was here.
Mm-hmm.
And I truly believe that you can't strive for excellence, or you can't achieve institutional excellence without diversity, equity, and inclusion. And so with all of my lived experiences, with my identities, the intersection of identities, I show up as my authentic self every single day in doing the work that I do. I remain a learner. I remain humble in this work. And I think that's helped me, be strategic in the ways that we align our work with the overall strategic plan for the university.
Wonderful, wonderful. So thank you for your willingness and your candor in sharing some of your personal journey with us. I think that story is quite stimulating, especially in the context of education being a game changer. And I know that that's what you're trying to do here at the Miller School of Medicine. So it's just a great transition, great segue into the topic that we want to cover today. But first, let me start by framing it.
Sure.
According to the AAMC, we know that roughly 5% of the physicians in the United States currently happen to be Black or African American. 7% are Latinx, and maybe less than 1% would be classified as Native Americans, Native Alaskans, and so forth. So we have a problem. How important do you believe is diversity in terms of in the context of promoting health equity? We know some of the data that show that when there is convergence between the patient and the provider, there seems to be better health outcomes. And so framing it all together, how important is diversity and inclusion in our goal as a medical school health system to promote health equity?
It's our responsibility as an institution of higher ed to develop the next generation of physicians that is representative of the diverse communities that we serve. And as you stated, data shows that many of our historically excluded groups tend to go back into the community and underserved communities and serve them. And there are better outcomes. And so I believe that programs like our Medical Scholars Program that has a long, rich legacy here at the Miller School of Medicine is part of that national change. And we're creating pathways into medicine for students that maybe at other institutions didn't receive the guidance or the resource. It's really a level playing field for our students. And we're already seeing some great outcomes at the high school level, at the college level that we can talk about as well. But again, it's our responsibility as being part of, a national commitment to diversify medicine as we know it.
So in this context, creating a pipeline of underrepresented minority students who aspire to become doctors or are prepared to enter the medical profession is a social and moral responsibility for the middle school.
Absolutely. And no one understands that better than you. You've supported these programs since you arrived here at the Miller School of Medicine. And, again, we're building on this rich legacy spanning over 30 years. And we've produced thousands of physicians that are now practicing all over, not only the country, but the world. And, part of this commitment is to create that pathway into medicine students don't know what they don't know.
Mm-hmm.
Navigating medical school, the complexities of that can be daunting for a lot of students, not even just URM, but all students. And so what we do is we work one-on-one with each student. We provide assessments on their portfolio. We assess their readiness for medical school and provide the resources, which, as we know, sometimes can be the challenge and the obstacle. Things like MCAT prep, access to research, different things like that, so they can be competitive applicants.
Sure, man. That's a great segue into the real topic. And Dr. Vega, you have had tremendous success setting up those pipeline programs. Probably more success than any other medical school in the state of Florida. Tell us about the Medical Scholars program that you have created. I know there's several components, and I want you to break it down for us.
Yes,
every single one.
Thank you.
The target population, and the specifics about what you offer.
Absolutely.
In terms of developing that pipeline.
Absolutely. So I do want to recognize that I am building on the legacy of Dr. Astrid Mack, who was a physician here for over 30 years. And I am building on his legacy, and we're very well aware of that. For 30 years, he served as the Dean of Minority Affairs and single-handedly managed these programs through a variety of grants and support of the university. And so when I joined in 2010, the programs were no longer in existence.
Wow.
And part of
what happened?
I don't know. Where did they go, right?
So Dr. Mack was gone.
Dr. Mack retired, and
so
the programs went
retired.
away.
Okay.
The programs went away as well.
Wow.
So my first charge was to apply and hopefully become a competitive applicant for the HRSA HCOP grant, the Health Careers Opportunity Grant, which was a multi-million-dollar grant. No pressure, right? Your first 6 months here, write this grant, secure the grant. And we were successful.
That's why you're Nanette Vega.
Yes. And so we were successful, and we received the funding to establish not 3 programs, but 5. And so we focused on high school and college. And again, part of the agreement with Miami Dade schools, we have an articulation agreement with them and many of the science magnet schools to develop their students' interest in the health sciences. And we still do to this day. And then the other programs focus on pre-med students from around the country, with obviously a focus on our own here at the University of Miami and the South Florida area. We have a partnership now with Miami Dade College. We recruit students from all over the South Florida area, but our students truly represent the entire United States of America, and we're very proud of that. And so we work with historically Black colleges and universities. We work with pre-med counselors to recruit students and make sure that we have a competitive applicant pool. And so applications are available in December every single year for an incoming class that will occur during June and July. We receive about 125 applicants for 25 spots in each of the 4 programs now. And we just commenced our class of 2022. We had 75 students from all over the country. Some programs we had to adapt to a virtual platform because that's our reality right now. But we had the opportunity to bring our research scholars on campus for the STIR program, which you established under your leadership, the Students Training and Research Program. And they had an opportunity to work one-on-one with our esteemed faculty in conducting research over the course of the summer and present their poster boards. So we're very proud of those initiatives.
So Dr. Vega, I'm a high school student, and I would like to become a doctor. So what program do I apply to?
We have many programs now. Actually, we are getting ready this fall to launch 2 additional programs that will happen throughout the academic year. But if you are a student currently attending a Miami Dade Public School, you can apply to the High School Careers in Medicine program, which is a program for rising seniors. It occurs during the months of June and July over a course of 7 weeks. And at the end of the program, you will leave with a portfolio and ready to apply to colleges and universities around the country. But what happens during the 7 weeks, we focus on a very focused science curriculum. We also focus on the SAT prep, which is very important. And then we also focus on the essay and letters of recommendation. So by the time that they leave, they have all of the components to apply for college when fall semester begins.
So great. I'm a college student. What are my options?
Yes. You have many options.
Yeah, you have at least three.
You have at least
okay,
three.
So tell me, just break them down.
So we encourage students to apply broadly. They do have three options. We have, I mentioned the MCAT prep program, and that is a program that we partner with Kaplan.
Okay.
And it's a 7-week intensive program, 8:30 to 5, Monday through Friday. Wow. Every single week they're doing comprehensive assessments. We actually mimic the environment of the actual MCAT exam every single week.
So MCAT boot camp.
MCAT boot camp.
Okay.
So it's very intense, and that program is limited to 25 students. Okay. It is competitive. We receive, as I mentioned, over 125 applications for 25 spots. But that program also has some elements of shadowing. Okay. We also have mentorship, so they receive a mentor as well. Then we have the motivation program, which is kind of like a mini medical school experience here at the Miller School of Medicine.
Really? Okay.
And we have our esteemed faculty who serve as instructors, so they get to experience their first semester of medical school here. Wow. They're in the labs, dissecting cadavers as part of anatomy lab. So it's very hands-on. And again, limited to 25 students, very competitive as well, but a very science focused curriculum, but also we focus on MCAT prep, but not as intense as the MCAT prep program.
Just experiential.
Experiential, correct. Okay. We also have, for the three of them, I think it's important to know, some of our medical students serve as teaching assistants.
Wonderful.
So that's an opportunity for them to mentor.
So role models.
Role models, right?
So you can, if you can be it, if you can see it, so
you can be it, right? Okay. And so a lot of our students are alumni of our program, so there's that connection as well. So it's a full circle moment for them to give back to a program whom they believe has given so much to them. And then the last program is actually your brainchild, which is the Students Training and Research program. And those are students who are focused on research. So they are interested in becoming a physician, but they also want to be a scientist and they want to conduct research. And as we know, this is a competitive part of their medical school portfolio. And many of our students are invited back to be a part of these research teams, become published, present at national conferences. So it's just not about the 7 weeks. These students become part of our office family all the way through, even after residency. So they remain connected with our office.
That's fantastic. That's fantastic. Well, all this sounds good, right? So what evidence do we have that can attest to the effectiveness of these programs? Do we have any data to support that they are making a difference?
We are, and I'm hoping to publish this really soon. We're working on the data collection piece, but I can tell you that I can tell you some examples. 100%. So 100% of our high school students, compared to Miami Dade graduation rates, which are about in the high 70%, graduate from high school.
Wow.
Okay. But we don't stop there. We encourage them to apply to college, so we're part of that process as well. And 95% of our students apply to college, get accepted to college, and 80% are on scholarship. So, almost debt-free, a lot of these students. And yes, some of them do stay here at the University of Miami. We wish they can all stay here. But what's happening is our students are very competitive and are going to other schools nationally. So we're very proud of that. For our pre-med students, about 60%, so 6 out of every 10 students that applies in that year for medical school not only receives interviews for medical school, but is accepted to medical school and attends medical school. 60%. And again, these are all historically excluded students. So African-American, Black, Latinx.
60%.
60%. And so right now we're tracking not only how they're doing in medical school, where they're going to residency. And anecdotally, I can tell you, and I'm hoping to prove this, a lot of our students are coming back for residency here at Jackson. And, we have several students already here that are recruiting other students to come back. So there's definitely a connection between our office, the program, the affinity that they feel for the Miller School of Medicine, and then wanting to give back and stay within the communities that they are very familiar with.
So for some of our listeners, which means as far
Yes.
as the podcast is concerned, this is a pretty worthwhile investment.
A worthwhile investment.
Okay.
For each student, it's about $5,000 to support one student in our program. But again, the investment is felt over a lifetime, right?
Amazing.
Because these students
Amazing.
come back to our communities
Sure.
and serve the underserved.
Sure. Certainly something to even share with the state legislature, don't you think?
Absolutely.
Yeah.
And so we're part of the Florida Council of Deans, and there's been lots of conversation around these initiatives, and we serve as a national model. We've consulted other schools on establishing their programs, so we're proud of what we've built here. And again, it would not be possible without the support of leadership.
And we're looking to continue to solidify our network locally. We have a partnership that we've just announced with Miami Dade College. Tell us a little bit about that partnership and how that fits within the context of developing the pipeline.
So actually, Miami Dade College is one of the first to enter in a memorandum of understanding, a partnership of sorts, where we will be, and we already started, we are working with their biomedical students in creating a pathway into medicine to the Miller School of Medicine. Actually, we had 5 of their scholars participate this summer, but we're also working with their advisors in making sure that they have real-time, up-to-date information on how to advise pre-med students so they are competitive in their application process. And then the next phase of this is to enter into partnerships with our Florida HBCUs, historically Black colleges and universities. I'm happy to announce we have one, you know, that has entered in an agreement in the initial stages, and I'm working on the 3. So hopefully in the next, year or so, we'll be able to announce that we're in partnership with all Florida historically Black colleges and universities, which, again, this is the pipeline, the pathway that we want to create into our School of Medicine.
I think that's really fabulous. And it shows your vision and your approach, your ecumenical approach to make sure that we're inclusive. But you also have a program to help train the Miami-Dade Public School science teachers how to more effectively teach and mentor STEM students.
Yes, and again, we need to go beyond this approach of a one-off, right? It really needs to be an integrated approach. And part of that is twofold. One is working with Miami-Dade Public School teachers to make sure that they have the resources that they need in order to encourage these students to pursue. Because oftentimes, a career in STEM, a career in health science is really not in the possibilities, right? In the world of possibilities for a lot of these students. So every single semester, and actually this year will be in October, we bring Miami-Dade Public School teachers from all around the county to join us here at the Miller School of Medicine, and they engage in workshops and trainings led by our esteemed faculty. It's a full-day comprehensive program supported by your office, and we will be doing that again this year. And in addition to that, we are expanding our pathway programs into middle school and elementary school this year. We secured 2 additional grants through the Miami Foundation, and the Miami Foundation is supporting our programs that are going into middle and elementary school. So these curriculums will be throughout the academic year, not just the summer programs.
Wonderful, wonderful. So we've heard about your story. You have emphasized the value of education, its importance in being a game changer. As you reflect on your accomplishments here at the middle school, professionally, and also your own journey, what are your hopes and aspirations for these underrepresented minority students who are entering the pipeline towards a career in medicine? What are you hoping they will do with the opportunities afforded to them?
My hope, and we're already seeing this happen, is that they continue to pay it forward. To whom much is given, much is expected. And I see a lot of our students come back either in, donating to the Administered Endowment Fund, or giving of their time, which is another way to give back, or being champions of this office. And I still have students who participated in these programs over a decade ago that refer students to these programs. And so this brings me so much joy to see students realize their dreams, but also to never forget who along the way helped them get there. And so I think that's the best outcome we can hope for.
Sure. And you also changing the demographics of the physician workforce.
Yes.
So that has to have some impact on health equity, huh?
I would like to think so. We are a part of this larger mission, right? As we know, and research has shown there's going to be a shortage of physicians. We need to continue to focus on this development of a workforce that really is representative of our community. As we discussed earlier, our historically excluded groups do go back into underserved communities, and there's such a need, and there is a direct impact on quality of care, on addressing disparities. Having physicians that are culturally humble doing this work is so key in addressing, microaggressions and biases and all of these things that we all have and experience. So we are part of this national cause that is really changing the landscape of medicine.
So what words of encouragement or advice do you have for underrepresented minority students who aspire to pursue STEM, but who get discouraged? They tell them, forget it, it's not going to happen. You just don't have the makeup for it.
That's a great question. I think, if I go back to the little girl, in a small town in New Bedford, Massachusetts, that was told no many times, me. I remember going to my high school counselor with my college applications, and she was encouraging me to apply for secretary school. And I'm dating myself right now, but, she didn't see me as I saw myself. So what I would say is surround yourself with people who are going to help you get there, because the resources are there. We live in the best country in the world, and I still believe that. And yes, we are up against some systemic issues, but there are enough of us doing this work where you can, identify the resources necessary to level the playing field and to help build that cultural capital so you can navigate the complexities. And also, I would say, invest in yourself, right? People invest in those that invest in themselves. And so it begins with you. And I'm always going, above and beyond for students who I see, taking an interest in themselves and doing everything possible. So I would say those two things is investing in yourself and seeking out those people and those resources that are available. And don't listen to the no's, right? That is my biggest motivator. Tell me no, and I will prove you that I could do it, right?
No means not now.
No means not now, not never, right? And so surrounding yourself with people who, you see yourself in them. And I think that's why it's important to have people like us in leadership who lead with vulnerability and share our stories and are transparent. And there is no shame with, how I grew up. And, I think it's a matter of creating environments where we can really show up as our authentic selves to do our work, because then they see us. And they know that we see them and we believe in them, and that it continues to pay forward.
Wonderful. And more concretely also, they can just go to our website, Tree can tell them, and apply to some of our programs, right?
Yes.
The Medical Scholars Program. That's why we exist.
Yes, and that's why we exist. So diversity@med.miami.edu. Applications will be available for summer 2023 in December with a deadline in March. Students will receive notification 2 weeks thereafter as to their acceptance to the program, with a start date of June and July. So we look forward to our next cohort.
That's a great way to end. Dr. Vega, it has been a joy to talk to you this morning and to learn from you, and to explore your passion for diversity and inclusion. And I'm just so happy and grateful that you are the Assistant Dean for Diversity, Inclusion, and Community Engagement at the Middle School of Medicine.
Thank you.
Absolutely wonderful work you do.
Thank you. I appreciate your support.
And for our listeners, Dr. Vega epitomizes the commitment of the middle school to promoting health equity by advancing diversity, equity, and inclusion. We are glad that you joined us this morning, and we hope that you'll tune in again for the next episode of Inside Miami Medicine. Until then, I'm Henri Ford, the Dean and Chief Academic Officer of the Middle School. Bye.